Hi, this is Dr. D, and today we will talk about 10 symptoms you should never ignore. I am a GP in the UK, and on my YouTube channel I talk about common symptoms and conditions that we see in general practice. This video is not for doctors, but for patients, where I explain the symptoms and provide advice about what to do about them. If you want to receive updates about the new videos on my channel, please click subscribe and notifications buttons. Today we will talk about 10 symptoms you should never ignore. Each of us has aches and pains from time to time which bring up the question, is it serious or is it going to go away by itself? Should I just wait? Should I call someone? Today I will tell you about symptoms that you should never ignore and call your doctor immediately. Starting from the top, the first important symptom not to ignore is sudden severe headache. If you experience headache unlike any you've ever had before, especially if it is sudden, please urgently contact your doctor. This is especially important if you have any other symptoms like problems with speech, vision, hearing or moving your arms and legs or with your coordination. Also, if you have severe headache and fever, with or without neck stiffness and pain on looking at light, contact your doctor immediately or go to emergency department. Other headaches not to ignore are the ones that you wake up with daily, and that get better during the day. Also, important headaches to report immediately are when touching your face or temples causes pain. You should also contact your doctor if you develop painful rash on your head or face. Down from the head is the neck. One important symptom to keep an eye on is neck lumps or any persistent problem with swallowing. Any such symptoms should be reported to your GP as soon as possible. Down from the neck is the chest, and there are two important symptoms we should never ignore about it. The first is the chest pain. There are many possible reasons for chest pain, but it is always important to ensure it is not related to your heart. The symptoms that you should be worried about are any intense central or left-sided chest pain, discomfort, heaviness or pressure that feels like squeezing. Any chest pain that shoots up to your jaw, neck or arm. Chest pain accompanied with nausea, sweating, and shortness of breath. If your symptoms last more than 20 minutes, call 999. If you have similar symptoms occurring on exercise but relieved by rest, call your GP. Additional worry is a severe chest pain that shoots to your back and sometimes also arms and legs. This also warrants a 999 call. Reassuring symptoms with chest pain are when it is caused by either moving your muscles or by pressing on your chest. It is likely to be musculoskeletal. Acid reflux also commonly causes chest discomfort. If Gaviscon helps your chest pain, then it is likely related to reflux. Remember to always discuss it with your doctor anyway. The second chest symptom not to ignore is sudden shortness of breath. There are several conditions associated with this symptom, including pulmonary embolism, when a blood clot blocks a blood vessel in the lungs, and pneumothorax, when air gets trapped between the linings of the lungs. Recent travel, surgery and immobility make you prone to pulmonary embolism, while chest trauma, tall and thin build and hypermobility make you susceptible to pneumothorax. Additional symptoms could be chest pain and coughing up blood. In either case, a sudden onset of shortness of breath is an emergency and you need to visit the emergency department or call 999. If you have shortness of breath that is not sudden but has gradually worsened during weeks or months, you need to see your GP as well. There are many possible causes to that, but some are sinister and need investigation. Same is about a cough that you have more than 10 weeks. Down from the chest, another symptom you should not ignore is sudden or severe abdominal pain. If a pain is to the extent that you cannot tolerate, or you feel very unwell or feverish, you need to go to the emergency department. There are many causes for severe abdominal pain, such as perforations, pancreatitis, appendicitis or ruptured aortic aneurysm. All these require immediate treatment. If you develop less severe, but regular abdominal pains, speak to your GP. The sixth symptom you should not ignore is a red, hot or swollen leg. If you have a sudden onset of these symptoms, you should speak to a doctor the same day. The three most likely causes include a blood clot, an infection, or a gout attack. While infection and gout attack can be often treated with tablets at home, a blood clot is very important to rule out, as it may potentially cause pulmonary embolism, which is life-threatening. If you notice a gradual onset swelling both legs, speak to your GP. They may need to investigate this further for systemic causes. Now, from body part-specific symptoms we go to the systemic symptoms. The first one not to ignore is sudden confusion. If you're experiencing sudden confusion, personality changes and inability to concentrate, it's important to see a doctor right away. There are many causes for confusion, and in elderly patients, infection is the most common. However, electrolyte imbalances, brain tumor or bleeding in the brain could be behind these symptoms as well. Think about FAST acronym for strokes, face, arms, speech, time. If your confusion has sudden onset or is associated with any of these symptoms, dial 999. The eighth symptom not to ignore is high or persistent fever. Particularly if you had it for more than a week or which is not responding to paracetamol. Fever is usually associated with infections such as chest or urinary tract. Other less common sites are the heart, endocarditis, or brain lining, meningitis. Bacterial infections can be severe and usually require antibiotics to clear up. If you feel unwell, you need to speak to your doctor same day. A persistent low-grade fever lasting for weeks could be associated with some cancers, like lymphoma and leukemia. The ninth symptom not to ignore is unexplained weight loss. In this age of common obesity, weight loss that you have not actively contributed to, usually indicates a systemic illness that requires investigation. Losing more than 5% of your body weight without trying, over a period of 6 months could mean cancer. Other illnesses like endocrine disorders, such as thyroid or adrenals, can also lead to weight loss. If the weight loss is accompanied by extreme thirst or hunger, fatigue and frequent urination, it could be a sign of diabetes. Gastrointestinal conditions like inflammatory bowel disease and celiac disease can cause weight loss as well as diarrhea and abdominal pain. Depression and other psychiatric conditions could be to blame too. Overall, patients with unexplained weight loss should undergo a workup to rule out sinister causes. Finally, one condition not to ignore is unusual bleeding or black stools or black vomit. If you have any of these symptoms, especially if associated with weight loss, change in bowel habit or low-grade fever, you need to see the doctor as soon as possible. There are also benign causes for bright red rectal bleeding, including hemorrhoids and anal fissures. Vaginal bleeding is also never to be ignored, especially if between periods or after the menopause or associated with pain on intercourse. It can be linked to gynecological cancers. Blood in urine also warrants investigation. Quite often it could be a result of an infection, but if not, it needs to be investigated. Coughing up blood can happen with non-cancerous conditions, like bronchitis, pneumonia or tuberculosis. However, all these have to be investigated as soon as possible and treated. I hope you have found this short video useful. In the description there are links to the NHS and gov.uk websites where you can read more about when and how to see your doctor. If you liked this video and would like me to make more videos, please support me on Patreon, the link is here and in the description. If you want to see a video about COVID and COVID vaccines, please click on these links. If you would like me to speak about more medical conditions, please leave your suggestions in the comments.